Vaccination isn't a private choice. It's an act of collective responsibility. It's the social contract that binds us, the very contract that allowed us to eradicate diseases like smallpox, which once killed millions. To reject the mandate is to tear up that contract and endanger the most vulnerable, newborns, cancer patients, the immunocompromised.
Your social contract is a contract signed in someone else's blood. You speak of the collective, but you erase the individual. The right to bodily integrity is sacred, inviolable. No state can force a healthy citizen to undergo a medical treatment against their will, making them assume a risk, however rare, for the benefit of others. That isn't solidarity, it's coercion.
Your freedom ends where the community's safety begins. In a pandemic, the choice not to vaccinate isn't a private act. It's a potential biological weapon. Herd immunity is the shield that protects everyone, and for diseases like measles, it requires 95% coverage. Experience shows we don't reach that threshold with mere recommendations. A mandate isn't force, it's the mathematics of survival.
And in your mathematics, the individual becomes a disposable unit. The state itself admits this with laws that compensate those permanently harmed by vaccines. It's a tacit admission. We know some will be harmed, but we accept it. Go and talk about the mathematics of survival to a family whose life has been destroyed by a severe adverse event. For them, that rare risk became a 100% certainty.
And I ask you to go talk about bodily integrity to the parents of a child who died of measles because there were too many unvaccinated children in their classroom. The risk from the disease is orders of magnitude greater than the risk from the vaccine. The risk of encephalitis from measles is 1 in 1,000. The risk of a severe reaction to the vaccine is less than 1 in a million. Rejecting a mandate means consciously choosing the greater risk. It's irrational.
There is nothing more irrational than destroying trust to obtain obedience. Mandates create psychological reactants. The more you force people, the more they resist and retreat into misinformation. Instead of educating, you radicalize. You create an unhealable fracture between citizens and institutions. A Pyrrhic victory. You get higher coverage today at the cost of a more divided, suspicious, and ungovernable society tomorrow.
Trust is built on results, and the greatest result of medicine is freeing us from scourges that have plagued us for millennia. Look at the data. Thousands of polio cases a year in the 60s, 0 today. This didn't happen by chance. It happened thanks to systematic vaccination programs supported by mandates. To deny this evidence isn't skepticism, it's historical denialism.
And to deny the suffering of those harmed by those same programs isn't science, it's inhumanity. The associations for the vaccine injured speak of a second ordeal, the ordeal of not being believed, of being accused of looking for someone to blame. A mandate turns the doctor from an ally into a bureaucrat, and the patient from a person into a cold statistic to be sacrificed on the altar of public health.
No doctor denies the possibility of an adverse event, but every day we weigh risks against benefits, and the verdict of science after billions of doses is unequivocal. The benefits of mass vaccination overwhelmingly outweigh the risks. A mandate is simply the tool that makes this benefit universal, that leaves no one behind. It is the pinnacle of social responsibility.
No, it is the abdication of individual responsibility. A truly healthy society is not built on force, but on trust and freedom of choice. A society that must violate the bodies of its citizens to protect itself has already lost its soul. The right to say no over one's own body is the last uncrossable boundary of human dignity, and no collective interest, however noble, can justify its violation.